Hello, my friend Max. So good to see you.
Hello there, beautiful. How are you doing today? It's a bright, sunny day here in Texas. I don't know about where you are.
It's beautiful in Virginia. It's a little bit cool for the time of the year, but I'll take it. That humidity is about to come in.
Sounds good, dear. So what are we going to do today?
Well, today I want you to kick it off by telling everybody why TMD belongs to the dental profession.
That's a great, great topic. And so let's start with that. And I'd like to name TMD, the Great Imposter. Why am I saying that? Because it acts like migraines, it acts like cluster headaches, it acts like earaches, and it's very confusing to those who have it and don't know what's going on with their own body. I mean, imagine waking up with a severe earache and it's just killing you. You can't move your jaw, you can't do anything. And your spouse is worried. They go to the ER. The ER looks in the ear and says, nope, ear looks fine. Let's
Mhm.
do an MRI. Well, that scares the dickens out of you because you don't know. It might be a tumor. It might be no telling what it is.
Right.
And so you wait for 2 or 3 weeks for the MRI report to come back, and it comes back, and the doctor says, no, you're perfectly okay.
Mhm.
Must be just in your head.
Right.
So, and all along, it's the joint. It's all the nerves behind the joint. It's being compressed. You know, we've been talking about compressed joints for all of our podcasts, the previous podcasts. The MDs have no clue that it could be the joint. And here's another thing. When they order the MRI, they're ordering the MRI for tumors, and they're not ordering the MRI for a joint scan. If they ordered it for a joint scan, the radiologist would have said, hey, there's a problem within the joint. And then the MD might have an idea what to do. So let's
No,
take
they
an
don't.
pardon?
No, they
No, they
don't.
don't. Well,
You
let's
know
take
how
an
many times I've had a patient come in with that MRI saying the disc is displaced? We know the disc is displaced. The MRI just says, where is the displacement? But then nobody knows what to do with it, right?
Well, that's true. That's true. And they'll say, well, it's just a clicking joint. I mean,
Yeah,
that's
that's
all it
fine,
is. It's not hurting you. So it
right?
just doesn't hurt, and then there's nothing wrong.
You just have a
Oh,
clicky joint and you're crazy because nothing's wrong, right?
that's right. Okay, so that scenario holds true for a migraine. Doc, I have a horrible, horrible migraine. Go to the neurologist. This is just a different doctor, but it's just as unaware as the other doctor is. And all they'd have to do is push on the joint, the ENT, if it was an earache, push on the joint and ask questions like this and say, oh my gosh, it's not an ear problem, that's a joint problem. And send you to the appropriate dentist. There's where the problem is. Because how in the world do you know what dentist is appropriate? Going to see your dentist, your family dentist, is not the answer. Your family dentist would have found that a long time ago. So it's the same with a neurologist. Go to your family dentist. No, they don't know anything about what you and I do. So this great imposter this problem starts in dental school. At
Right.
least in my dental school and in your dental school, things are changing now where TMJ is being taught in some dental schools, but only a very few. And thanks to the American Academy of Oral Pain that they have this movement started. But the AAOP has a huge uphill to climb because they can't force dental schools to teach TMD. They can only encourage, they can only give them help. So when you have your medical doctor on one side and your dentist on the other side, and they don't talk,
Mhm.
there is no communication between the professions. Even the insurance has separated the teeth from the body. It is a shame. It is ridiculous. So the first step in TMD awareness is going to be with you, the listener. You're going to have to demand that the physicians, that the dentists know something about your problem. Now, you're not the problem. You pain patients, listen to me. You're not the problem. You have a problem. And you have a problem that can only be treated by people like Pam and I that understand the mechanics. But it's not just the mechanics of the jaws, the lower jaw hitting the upper jaw, the teeth hitting right, it's also being listened to. It's also being believed. It's also giving spiritual guidance. I mean, so this is and all of you that are listening to me that had this pain, you know what I'm talking about, because stress affects your pain level. But you also know that your teeth don't fit. You also know something's wrong. You know something's wrong with the way that you open your mouth, a deviation that we've talked about in previous podcasts. So I am advocating that dentists like you and I approach medical schools to teach their students how to screen for TMD pain. Then we have to explain to them how to find a TMD dentist. So it's a huge problem. What are
Well,
some of your ideas? Because you're young, you're involved with dental school, and you're involved with pain patients that you see every day. You know what the crisis is.
well, first of all, can we address the fact that you called me young?
You are.
Thank you. That might be the only thing false that you said this morning so far. Um, so I don't know if our listeners know this, but as far as I know, the medical schools do not teach anything about teeth at all or the oral cavity other than to look for tonsils, which we know that's, kind of remiss as it is. My father was a medical doctor before he retired, and we were very involved in the medical community. So I have some background in there, and
Mm, good.
that still going back into the dental schools, I'm exposed to some of that. But and then also a lot of the doctors I collaborate with, they're very honest. They're like, we are not taught anything about teeth. So I've had good success with working with different type of chiropractors and physical therapists, some speech pathologists, to just be like, listen, you don't need to be a dentist. I'm not trying to be a chiropractor or a physical therapist, etc. We all have our specialties, but we need to have a general understanding of what to look for. If you're a physical therapist that treats TMD, okay, because some people advertise for that, they claim that specialty or that niche, then you need to understand, let me show you if the teeth look crowded or crooked or over closed, like we talked about on a previous podcast, if the jaw is narrow, I teach them how the face and the posture could look to the chiropractors and physical therapists. So I've had a lot of success with them, the ones that care, and they're not just trying to have repeat service,
Right.
constantly adjust, but they're frustrated because their intent is to help and create wellness for that person. So they hit stumbling blocks, like patients can't hold or stabilize. And so that's when they finally reach out and we talk and we learn with one another. But I have never till this day had any success in being able to sit down with any ear, nose, and throat doctors, any neurologists, or primary care physicians, none. And that's how it's heartbreaking because, like you said, it's fragmented. And if we can just have an understanding of just the basic fundamentals, what to look for. Like, I know that if someone's posture is off and they have forward head posture or shoulder lean to the right or the left or rotations, I can help with some of that, but I don't have all that understanding on how to truly correct the situation and be able to analyze what went wrong there. So I need to collaborate with somebody who does, if that's what my patient's seeking, is that type of wellness.
Well, I had a classmate that is a neurologist in my area, my high school classmate. And I went and had a long talk with him in his office, and there was zero interest, zero interest. In the last year, I've attended two classes at advanced continuing education and listened to neurologists. One was at ICMO and one was at the AOP meeting. And went up to talk to them afterwards and say, if you're not really familiar with TMD, how can you do a differential diagnosis when you're doing migraine Misdiagnoses, which we've talked about before. They didn't have an answer and they weren't interested.
Right.
So, but I'm going to tell you where the interest is going to come from. It's going to come from the demand of the patient. When the
Right.
patients start demanding and start, exposing these MDs for not knowing the difference between a migraine and TMD, there should be a difference just from a pride reason. I mean, can you imagine your patient telling you, oh no, that you're not, what's happening is not my ear, it's my
Right.
joint being pushed into my ear.
I think one of the good things about the internet is the vastness of information. That could be, it's a double-edged sword, right? People start to Dr. Google themselves. People come across not accurate information, but there is some good information. They just need to filter through that. And your upcoming book that you're writing, I think does a really nice job helping people navigate to like, okay, the right questions to ask, how to kind of diagnose yourself. Because again, I say, I can't tell you the countless conversations I have with the new patients coming into my practice and their frustration. I had a young lady yesterday, she is in her mid-teens. She's so mid-face deficient. She's had braces, so she has this nice straight teeth. And I always tell them, and this is true, the problem is you look pretty. I mean, your smile is straight, so everyone thinks that there's nothing wrong with you. And she has had a sleep study done. On her sleep study, it says that she has moderate to severe sleep apnea. And the ENT still refuses to take her hypertrophic, enlarged adenoids and tonsils out. This girl wakes up with migraines every day. She's tired all the time. They say that she, excuse me, is a bitch because she's cranky all the time. Where's the justification in that? I understand when we don't know what we don't know. It's frustrating when people don't want to know, especially as
Right.
a doctor. That is our obligation. That's why we went into these fields, is to help people. We're not responsible to know everything, but we are responsible to continue to learn and educate ourselves so we can keep up with the changing needs in humanity and what people are going through. But when it is blatant that there's a problem, how can you close your eyes to it? And for many years, I try to remain professional. I still do. But at this point, I'm like, go get a second opinion. Because does that make sense?
Partly we develop a podcast called Open Up where we tell the truth and just expose it to the whole world,
Which,
which
by
I
the way,
love.
listeners, please, like if you're listening, Mac and I do this because we do want the world to start slowing down and spending time and listening to one another, having the time to diagnose their patients correctly when it comes to the allied professionals. But if you have questions that is very specific, write it down, send it to us, please, because we will start going through questions and answering questions on these podcasts. Our goal is to just touch as many people as possible because, we're just two people.
So you've met with ENT. Well, you haven't had very good luck with ENTs, neurologists, but with chiropractors, PTs, massage therapists, etc. And they all are a part of this because either they deal with muscles or they deal with joints or they deal with both. Okay, so with TMD, you got a joint issue and you got muscle issues. You got to ask yourself, why? Well, the why is what we do. It has to do with the way the teeth and the jaws come together. So we're the only experts when it comes to the teeth. A physical therapist or chiropractor, massage therapist may be able to put the condyle back where it's supposed to be for a limited amount of time,
Correct.
but they don't ask themselves, why is it incorrect? Why are the muscles happening? I can do trigger point injections. I can get Botox. I can get deep massage therapy. I can get help with my muscles, but why did I have it and why does it come back? It belongs to the dental profession, but only to the dentist who has spent time, money, and emotion learning how to treat the pain patient. We're a rare breed. And you and I are trying to make a difference on getting other doctors involved in this so that there are more people helping those in pain.
Agreed, 1,000,000% agreed. And to our listeners, I just want to do a quick review with how things work, in the sense that if you take this triangle and, on each point of the triangle, you have the TM joint, okay? And another point, you have the muscles that posture the jaw and space, like the ones that help us chew and talk. And then at the third point, you have teeth. This triangle has to work harmoniously together, but the dominant factor ends up being the teeth. Like, what is the teeth position? What does the bite look like? Because if we go back to previous podcasts, remember, the mandible, the lower jaw, is a floating bone. It's like a porch swing, right? And what stops that mandible in space is how your lower teeth fit to your upper teeth. You bite down, your jaw stops in space. And once again, remember, the mandible at the very top of it, right by the ear, is half of that TM joint. It's the ball that fits into the socket of the skull. So if your teeth are on the wrong place and your mandible it pushes the mandible in the wrong place, which now aggravates the muscles, because the muscles have to compensate for this poor position all of the time. And then the joint starts to get affected because the muscles don't support that joint. And that causes all the issues that people suffer from, all the symptoms, whichever ones it may be. So this is why TMD does ultimately belong to the dental profession. But like you said, it has to be people with a certain level of education. And while there, in mine, in your eyes, is a blatant need for a more education, more understanding, the dental schools are not getting it. And unfortunately for our listeners, there's I don't even think there is like 3% of the dentists that do what we do in the entire country. So it's so hard for people to find the right care. And
So how about go ahead.
treating it with like the Botox and massage and chiropractics, that's all fine, because that might be all you can do for the time being. But you're right,
True.
it does not solve the problem. They're good tools.
So how about a podcast where we discuss what would it take for a dentist to become excited about learning how to treat the pain patient?
I like it. I'm interviewing doctors to help me in my practice. And I think I can help with that podcast, because I've got some feedback for you on that one.
Well, good. So we can do that in the podcast. But yes, I think this is all very exciting. Go
All
ahead.
right. Are we going to wrap it up for today? Maybe we should stop right there and kick it off next time with what would it take to get dentists to learn more about TMD. Sound good?
Right. Sounds good to me, dear. Later.
Have a good one. Bye.